20 seconds. Oz Gags here as we turn the corner on the 10 o'clock hour, and as we do every week at this time, we talk medical issues here or health issues around our area. And today I'm lucky enough to have Tony Long back with me from the Fort County Adams Board. And Tony, the Quality Improvement Director with Fort County. And Tony, welcome in.
Thank you for having me, Jim. It's great to be back.
Good to have you back. It really is. You know, even though if somebody would have heard you off mic a minute or two ago, I think even the guest that we brought in would wonder, why do you bring her back? But I love the truth, and the truth may hurt, but the truth is still the truth.
That's right. That's right. We're not getting any younger, that's for sure.
Tony, actually, when I told her I was basically 64 going on 18, Tony reminded me that my best days were behind me at this point.
I think what I said was you were at the pinnacle of what's left, Jim.
Oh, that's
right.
Yeah. Well, I think I need some of your crisis teams now. I think
that's right.
I might be over the edge here, so thank goodness you're here right now, and just in case I go through some sort of attack here.
That's right.
In the next few minutes. That's right.
Well, you've got two qualified people here to help you.
That's the important part. That is the important part. You brought a guest today, and I'm going to let you introduce him, Matt Rizzo. And tell me a little bit about Matt and who he is.
Well, what I'm going to do is I'm just going to introduce Matt, and I'll let Matt share a little bit about himself. But Matt Rizzo is the CEO of A Renewed Mind, and this is one of the mental health and addiction agencies that contract with the Fort County Adams Board.
Ah, there you go.
Yeah.
Matt, welcome in today.
Thanks for having me. I appreciate it.
Give me a little history about yourself, because you still have a little bit, and I know a little bit about you. You still got a little bit of that New York twang there, you know what I mean?
Yeah.
So tell me where you're from.
So I'm originally from upstate New York, but my heart is in Ohio. I'm actually an Ohio State alumni, so go Bucks.
Yeah.
So, yeah. So I've been around for a bit and been the CEO at A Renewed Mind for probably about 4 years now. And Renewed Mind's been around since 2007.
Okay.
We provide behavioral health care in over 9 counties, and we focus on treating mental health issues, addiction issues, and now most recently fetal alcohol syndrome spectrum disorder issues as well. So.
Wow. Have we gotten to that point where that's a necessary service to deal with on a daily basis?
Well, there was a recent article that was put out by JAMA, the Journal of American Medical Association, that they believe that 1 in 20 kids are affected with fetal alcohol spectrum disorder. So more and more research coming out, so we want to be ahead of the curve and see what we can do to help moms and kids.
That's amazing. That is amazing. All right, back to your history right now. I got a little too deep too fast, Tony, didn't I? Huh?
A little bit. No.
I heard that, though, and I just couldn't even imagine. But I can see how that probably is a problem at this point in time. You come out of New York. You go. How did you end up at Ohio State?
Well, first I went to Bowling Green, did my undergraduate work there and studied social work, played a little bit of hockey there, enjoyed my time, met my wife down in Bowling Green, then went on to get my master's degree at Ohio State in social work and administration, did a quick trip back to New York and got another master's degree in public administration and healthcare, just to get a broader picture of where our field was moving. And unfortunately, my father-in-law developed some heart disease, so we moved back probably about 12 years ago and been here ever since, and just really have enjoyed working with the community and working with several of its leaders, and just think it's a great place to be in Northwest Ohio.
Yeah. So when you came back, is that when did you found and start Renewed Mind yourself, or is this a program that is more wide scope than just Ohio?
A Renewed Mind is in Ohio, Northwest Ohio, about 9 counties. Began in 2007. I did not start A Renewed Mind. I came shortly thereafter in 2009, and at that time we probably served about 10 kids providing addiction treatment. We had 3 or 4 staff. And then just over the last 10 years or so, really exploded, especially as the opiate epidemic has gotten worse in Ohio. We provide a lot of medication-assisted treatment to help folks who struggle with addiction. But we've also recognized through our evolution, if you will, that when you work with folks who struggle with addiction, you have to work with mom and dad and the family system. And 65% of our folks who struggle with addiction have co-occurring mental health issues. And so we really focus on treating the whole person and working with families and working with communities, and recognize that it takes a community effort to really attack problems effectively.
Yeah, it really does. Tony, then how does Matt's company interface with the Fort County Adams Board then? How do they fit here?
Right. Well, the Adams Board actually takes federal dollars as well as state dollars, and we then use that money along with levy dollars, and we contract out with different providers. And Matt is one of the providers that we contract with for both mental health and drug addiction services here.
And a lot of the services, it makes more sense, probably financially, and to be able to go and reach out to Matt than try to hire your own people here to do all of that work as well.
Yeah, the mental health structure in Ohio, each of the 88 counties in Ohio have Adams Board representation.
Okay.
So we don't actually provide any services. We are part of the delivery system in that we, again, we contract with them. We also provide a certain amount of oversight as far as compliance with things like access and quality of care. But we don't, as an Adams Board, provide any service. So we would always reach out and contract, but we've had the opportunity to actually expand our contracts with Matt's agency because there's been some changes in our delivery system.
Yeah, no doubt. So Matt, you and the Adams Board, what was your first contract? What was the first time that you guys shook hands and decided that it was time to bring your group aboard? Well,
if you know Les McCaslin, it was certainly memorable. Just a wonderful advocate for mental health and addiction services. So we were first asked to come out to Alberton, Ohio to assist with running Fresh Start, which was a men's inpatient residential unit that treated addiction and mental health issues. And then very shortly thereafter, as many of the clients were completing treatment, there was a need and a request from a lot of the clients to continue outpatient care in the Fort County area. And so with that, offices were opened in Defiance, Wauseon, Bryan, and Napoleon. Our most recent building was constructed in Napoleon to provide inpatient residential care for men. So we transferred the services from Fresh Start to Napoleon. As you know, if you've ever been out that building was very tired, had seen a lot of use, served a lot of clients for a long time. And so Napoleon is now open and functional, and I'm here to tell you today that since its opening in this past November, 16 of our beds have been filled pretty consistently, so the need is still there. We also provide recovery housing in the Fort County area, so we have a recovery house for women in Wauseon. We partner with Upton Heights and Defiance to provide recovery housing. So from the very first experience with Fresh Start, it's just evolved, if you will, and a lot of it's driven by the support from the Fort County Adams Board, drug courts, various probation departments, and just different referrals sources, if you will.
You threw a number out at 16 beds. Is that the number of beds that you have in that facility over at Napoleon, or do you have a few more than that?
We have up to 18 beds, and sometimes depending on when people are leaving, when they're going, sometimes we can do a little bit of overflow if there's a need. But generally, our average daily census is about 16.
Wow.
So we can handle up to 18, but we're generally around 16.
A number of folks are aware of how this all works, okay? But I think for the average person who does not have any addiction issues or doesn't have any family members with those issues, they may not really understand what happens here. So let's walk through a scenario real quick. How does somebody end up at your facility over in Napoleon here?
So if a person is struggling with addiction, and it's not just opiates, it's alcohol, it's benzodiazepines, it could be marijuana, it could be anything.
Sure.
So if a person's struggling with that, they can pick up the phone, call the phone number, we'll do a diagnostic assessment, and then if that level of care is identified as a need to come inpatient, which is a pretty restrictive level of care. And so a person to come into residential really has not been successful, as hard as they may try,
Sure.
Quitting using substances, if you will, on an outpatient level. So we bring them in for an inpatient stay for about 90 days or so to really give the brain a chance to heal, to help a person set up sober recovery systems, to be able to connect to outpatient effectively. So really they would call a phone number, which I can leave with you
Please.
to share.
And you can share it right now if you'd like to, if you have it right there.
Okay.
And I'd be happy to share it.
So a person would dial 419-924-2029, and they would call, and we'd set them up with an assessment, get them in as quickly as possible, figure out what level of care is needed, and then get the person to treatment as quickly, again, as possible. And, we wouldn't be able to do this if it weren't for the 4-county board being able to assist with funding to offset some of the costs, because residential care is very expensive. So, a big thanks to Les and the board, of course.
No doubt about that. Where would that cost come? All right, so I check in. I have now gone through that process. I've tried on my own. I can't make it happen. I need this 90-day getaway. Where does that money come from? Are there insurances that cover this? Do I pay for that out of pocket? Obviously you say Les and 4-county have some effect there, but where does the bulk of that money come from?
So 85% of the payment comes either from Medicaid or Medicare.
Okay.
So many of our folks have some type of public assistance. The leftover percentage is a mixture of commercial insurance, whether it's MedMutual or Paramount. And then there's a small piece that comes from the board funding as well. So, there's three pots of money, if you will.
Sure.
But the biggest public assistance piece comes from either Medicaid, Medicare, or the 4-county Animas board funds.
Yeah, wow, that's it's good that you're here. Tony, I know this is a problem around our area.
It is. And while I appreciate Matt talking a lot about the drug and alcohol, I want to make sure that people are aware that his agency provides more than that. They also provide a lot of mental health services as well.
Okay.
So if an individual, for example, was having some kind of an emotional crisis, or they were having a need for family therapy, or struggling with depression, anxiety, a renewed mind can also help with those. And I believe that the contacting for the agency and starting services and things would be very similar to the drug and alcohol.
Yeah.
You would call that number and come in for an assessment. But the board provides a lot of resources besides financial. We also have a lot of information that we can offer the people in our community. And one of the things that we put together was a drug protocol book. A lot of times when family members have some concerns about loved ones and they don't really know where to start, they don't know how to walk through that system of care. So if anyone was interested, they can reach out to the board and we can give them that booklet. And it literally walks them step by step on how to access care in our 4-county area, right down to how to make sense out of their insurance card.
Yeah. I think that's so important because it really is. Thankfully, there are a number of opportunities for people to take advantage of, but it's not as easy necessarily to find them if you have never done it before. If this is your first time, I'm sure a lot of folks look at it and say, oh gosh, how do I climb this wall right
Exactly. That's exactly it. And what we want to do is we want to take as many barriers. We want to remove those barriers between the individual who needs that care and actually receiving that care for themselves or their loved one.
Yeah, no doubt about that. And Tony, before we take a commercial break, because I need to pay some bills.
Yeah.
You know how that works?
Sure.
I've got to step away every now and then.
Yeah.
I love talking. I could talk for hours and hours.
Me too.
But if somebody would, before we go to break, if somebody would like to get in touch with the Adams board at all, and then they want some contact information
Right.
there, how do they call you guys?
They can call us right there at the board. Our number is area code 419-267-3355.
Very good. Well, right now I have Matt Rizzo and Tony Long with me, and we are talking about some of the addiction help that you can get around here, some mental health help. There have been some changes on the landscape, and we're going to get into those changes here in just a minute once we get back from our commercial break. It is 18 minutes after the hour of 10 o'clock, and you're in the medical show here today, and it's all brought to you by the medical specialty clinics of the Bryan Hospital and the community health professionals, and we'll be back right after this time out.
Here's the exclusive Q96.5 AccuWeather forecast. The wind.
All right. My computer had started up and was wanting to play music over top of it, so I turned everything on. These what they want to do, and you have to remind them that, you know, I'm in charge.
You make it easy, Jim. I always am a little bit nervous coming in here.
Huh? Well, we try. It's not that hard. How's that? Yeah. It's okay. You'll survive again. Now, you may need Matt's services a little more. You may have to go over and get some counseling after this is all done.
I know my boss is listening. I'm speaking to an audience of one today.
Community.
And aspirations for a title this year. Archbold at Bryan, Monday, April 16th, on the place where rock and sports collide, B-Rock.
Did you know that just talking to a friend or keeping busy with a hobby is good for your overall health? For more tips on keeping your mind and body healthy, follow #ForYourMentalHealth, a collaboration of the 4 County Adams Board and the 4 County Health Departments.
Back here in the medical show on a Wednesday, all brought to you by the Medical Specialty Clinics at Bryan Hospital and the Community Health Professionals. And with me is Tony Long from the 4 County Adams Board, and also Matt Rizzo, who works with A Renewed Mind. And we're discussing several things here today, and I think what we're going to lead into this segment with, Tony, is the change that did happen, because you guys had a major shakeup that kind of came somewhat out of the blue for you, I know.
Right. We did have some changes that came to our delivery system. In January of this year, the Adams Board received notice from Family Service of Northwest Ohio that they were going to be closing their doors. And here locally, they provided a number of services for our community. They provided our emergency psychiatric services. So, for example, if somebody needed to be screened and perhaps enter one of our psychiatric hospitals, they would need to go through Family Services' satellite location of Comprehensive Crisis Care to be able to do that. They also provided crisis stabilization for children and adults, as well as like a whole variety of mental health services. So when we received that notification, the board knew immediately that we needed to come up with a plan for how we would manage this. They said basically that the model, I mean, Family Services was an agency that had been around, not just locally, but also they served communities in Lucas County and Wood County as well.
Okay.
And so when they were talking about an agency closure, it was a complete closure. So this wasn't just impacting our area. And so our response to that was, of course, priority to our community and how we could continue to provide those services. And the board's response was, okay, they told us they were going to close because their model was not sustainable. It was going to close effective April 30th. What do we need to do? So what our response was that we would expand contracts with the existing agencies that we had so that the community would continue to get what they needed.
Sure.
And of course, we've been talking with Matt, and Matt's agency was a huge part of that.
Yes.
So the initial response by Les was that he would purchase the building that they were in. So 600 Freedom Drive, which is where the emergency services in our area are located currently and will continue to be located.
And that's Napoleon.
That is
right?
in Napoleon, 600
right?
Freedom Drive in Napoleon. So he purchased that building, and then Matt's agency will then move into that building and continue to provide those services out of that location.
Okay. Was there a gap? I remember seeing that whenever that happened on social media, you know, where people were all of a sudden reaching out saying, "Oh gosh, I heard these people are closing, and what are we going to do with this?" That's been a few months ago, though.
Yeah.
Wasn't it back then before the turn of the year?
Yeah, the board received notification of that in January.
Okay.
Yeah,
okay.
and again, they will continue to operate in our area until April the 30th.
Okay.
On May
okay.
1st, Matt's agency should be ready to take over. So the
So
community
there's no
should not
gap
feel this at all.
whatsoever, though.
They
Okay.
should not feel this. Now, there will be some changes.
Sure.
I think I'm going to let Matt talk a little bit about the emergency services piece, because that's the biggest part. We want to know that when people are having a mental health crisis, that their needs are met. I mean, that's priority number one. So I know a lot of the staff that were employed by Family Services will continue. I think Matt picked most of those folks up. So even the faces for our community should be the same. The expertise is going to be available. So our community, as far as emergency services, should not feel much of a change. And hopefully, actually, maybe things will even improve under Matt's organization.
So if there is any, I guess, good side to this, if you will, the good news is that the service site will not change.
Right.
Many of the staff who are working there will be able to transfer and come to a renewed mind.
Okay.
So that learning curve will hopefully be tiny, if you will, and so we'll have many of, again, those same staff. And then the crisis hotline number and the business number will also remain the same. And so we're hoping that, like you had mentioned earlier,
right,
there will not be a gap in service, that people will not fall through the cracks, and that, come midnight, May 1st, it's, basically many of the folks will just change companies, if you will.
Yeah, well, and that's good. That's great for our community, and we're happy that you can make that change, and we're happy that you guys were able to see far enough ahead and make and be agile enough to make that move like that. All right, I'm going to throw this out, and you're going to tell me it's above your pay grade, but maybe Matt will give me a feel for this one. How's that? Why would a group like that all of a sudden decide their business model was not sustainable? Were there federal funds or regional funds that were cut somehow, or what would have happened behind that? And inquiring minds want to know, as they used to say.
I can't really speak to what happened internally to Family Service of Northwest Ohio. I can tell you, as far as local funding and support to that entity, it was significant and did not change.
Okay.
So it had nothing to do with a change in local funds. The board continued to support the agency and continued to, monitor the quality of service, et cetera. So from our perspective, there was no change. I feel that it was more than likely just based on what Tim Yenrick, who was the CEO of Family Service, said, that the model simply was not sustainable. And again, I want to stress, this didn't just impact the four-county area. That was a complete agency closure. So they closed their offices in Wood County, and they closed their offices in Lucas County as well. So I feel like this was just it was a business that couldn't sustain for whatever internal reasons they had.
Okay, because when I saw that initially on Facebook that night, that's the first question that went through my mind. Okay, did we cut back Medicaid funds? Did we cut back, whatever, wherever that money was coming from? Why would something like that has been in the area since I've been up here, okay, go away like that? And again, then the other side is, fortunately, and the question in my mind, how can these guys do the same thing if that business model isn't sustainable? So, Matt, can we keep this thing going for a while?
Well, I can't speak to Family Services, but what I can tell you is healthcare in Ohio, that landscape is changing, especially with behavioral health care services. Managed care organizations will begin to manage the behavioral health care benefit for residents in Ohio beginning July 1st of this year. And so there's lots of different things that are changing. And so as an organization that provides behavioral health care, creating partnerships, making sure that we're able to provide services that we can bill for and then have a good collection rate on is really important. Having IT, having outcomes, all of those things are very difficult to manage for any healthcare organization. So we've been able to, because of our board of directors, the relationships we have in the community, just constantly trolling for grants and other ways to bring in funding. Diversifying our revenue has been a priority for us. Again, partnering where we can, making sure that we're connected to Adamus boards, the four-county one being one of our largest connection, if you will. So that's what we've really focused on as far as our business model, and we never want to abandon quality care. And so that's really at the center of what we do.
Yeah. Matt Rizzo with Renewed Minds, one of my guests here today, along with Tony Long from the four-county Adamus board. And, the reason I asked that question, and you alluded to it early, we hear about how broken our healthcare system is, and we all know that. Okay, we all know it needs some work. But you have you have a service right now that is necessary to be maintained. Okay, and I like to try to cut through all the baloney that goes on all the time, and unlike a lot of folks, not say, well, it's all their fault. Those darn Republicans, those darn Democrats, those guys in Columbus, whatever it might be. And I like to go more towards the root. You know, where in the world, how do we fix things? That's the way I don't really care whether a Republican or a Democrat fixes it, but I want to make sure that we have these types of services for people who need them, because this problem is getting crazy out there, guys, isn't it, Tom? I mean, there's a lot more people that need these nowadays.
That is true. And I think that the important thing to know is that the Fort County Adams Board we take our responsibility to the community very seriously. And so even in spite of this system change, you know, we regret that family services closed, but we knew immediately that we had alternatives. And I think that's one of the things that Les McCaslin, as the CEO, his leadership is so important, because he's constantly, while he might contract and set up a delivery system, he doesn't paint himself into a corner. He knew he had options, and we were able to respond pretty quickly to make sure that the services continued to be delivered to the community. We had contract expansion. Probably the largest, as I said, expansion was with Matt's agency, but we also expanded our contracts with Maumee Valley Guidance Center. They'll be picking up a lot of the prevention piece that the board contracted initially with Family Services to provide. And this would be where folks go into the schools to talk to kids to try to prevent concerns, whether they be drug and alcohol or mental health concerns, before they become a major issue. So we invest largely in prevention in this area too. So that contract expansion will also continue. I mean, Maumee Valley will continue to provide those services.
Yeah, well, that's good. That is good news. Any hope in sight at all for this opium problem that we're having nowadays, or the fentanyl problem at this point in time, or are we doing anything that makes any darn sense whatsoever, Matt, or are we going to just continue to spiral down the drain over the course of the next 10 years?
Well, I wish I could read the tea leaves on this, but I could tell you that if we're going to be effective, we have to do three things.
Okay.
Number one, we have to continue with our legal interventions with interdiction, drug courts, that kind of stuff. Number two, we have to provide prevention and treatment. So, like Tony had said, getting into the school systems, telling kids, hey, look at, here's the deal. These drugs are dangerous. We have more and more kids, unfortunately, experimenting with pills now than ever before. And so we have to do a really good job making sure that the prevention efforts and the treatments there, which the Fort County area has done pretty well.
Okay.
And the third thing is just to make sure that public policy-wise, we're looking at ORS reports. We're only giving a 5-day script instead of 30 days when it comes to pain medications. Drug take-back days, that we're really emphasizing those and telling folks, if you have expired medications or pills hanging around that you haven't used, get rid of them safely, of course. And so if we can continue to turn the volume up on those three things, hopefully we'll continue, we'll try to turn the tide here. So that's probably my best summary, if you will.
Are we still climbing an uphill slope at this point in time? I mean, is this problem still, even if it's a very small slope, is it still getting a little worse now, or have we crested maybe and heading down the other direction, or is it impossible to tell?
Well, I think every area is different. So we've seen some declines in certain counties, and then we've seen some upticks in other counties. I think the counties that are closest to, the Route 90s and the Route 75s of the world, they're at greater risk of exposure of moving drugs.
Sure.
And so those areas have been hit the hardest, where some of the pill mills have closed and people have had to turn to heroin and other things like fentanyl. Those areas are still trying to climb out of the hole. So there are some areas having success, and there are some areas that are still struggling.
Yeah, wow.
I know one of the things that we look at are overdose rates here in the Fort County area, and I can tell you, at least in Fulton, Henry, Williams, and Defiance, it's been pretty flat for us, and that's good.
Okay. That is a good thing. In fact, the times that we have talked, it seems like the suicide numbers were getting a little worse, and the drug numbers were getting a little better at some point in time. Are we still seeing that trend, Tony?
That has been the case. We still lose more of our community members to suicide than we do drug overdose.
Wow.
Now, I don't want to paint the wrong picture. I mean, obviously, with agencies like A Renewed Mind in our community, people are getting treatment, and so
Right.
that's a very good thing. So I don't want to, indicate that that isn't necessary just because people aren't dying by overdose.
Sure.
So I think what that points to is the fact that our system is working out here.
Right.
People that need help are able to get the help that they need. So.
And I also want to point out that we're not talking about hundreds of thousands of people here. I mean, again, we're talking about numbers that are down in the tens here.
Correct.
Again.
Correct.
So I think a number of people wander out all immediately and they hear, oh gosh, we got this suicide problem. Well, it's not like 1 out of every 2 are jumping off a bridge somewhere right at this point in time. We have a problem. We're identifying it, and we're trying to take care of that small number that's out there.
Correct. Yeah. And again, I think we talked about this the last time I was on. We continue to lose the same folks. It's the middle-aged males between 35 and 64.
Yeah.
So we're targeting them for services and awareness.
One more year, and I'm out of that. So
Then you're safe.
I'm still on alert here at this point in time. But I think by this time next year, I feel very comfortable that you can take me off that list.
Yeah.
How's that? That's the important thing. And the other thing I want to say before we take another quick break here real quick is that Les McCaslin is not allowed to retire.
He's not allowed to retire.
No,
We told him
I
that.
think at this point in time, whatever decision he's made, we have now revoked.
Yeah.
And as a means of county and Northwest Ohio service and stability, okay, Les has to work for another 35.
At least that.
At least 35 years. All right. I'm sure Les is really happy to hear that right now. Tony Long and Matt Rizzo with me right now. We'll be back to wrap up things here on the Medical Show right after we take this time out for commercials and also ONN News.
Jim, there's 2 more.
Sun tomorrow morning, then turning cloudy and chilly, high 43. Cloudy, windy, and cold Friday with a high near 40. I'm AccuWeather's Steve Williams.
And we're back here for the last segment of the medical show, brought to you by the Medical Specialty Clinics of the Bryan Hospital and Community Health Professionals. And with me here is Matt Rizzo with A Renewed Mind. And I think most folks have heard that company and that name around Northwest Ohio. And also Tony Long, and I know everybody knows about the 4-county Adamsport here in our area. And before we get into the last couple of items that we really want to talk about, I think we had a really interesting conversation just before we turned the mic on, and I want to share that one with the folks that are here, because oftentimes I say that the best conversations that we have at times aren't on mic, okay? And Matt, you were just telling me I don't really want to talk about the story that you related, but the amount of some of these drugs that it takes, or the little bit of nothing that it takes for at times an overdose and a death on some of the people in our area. Explain that again to me about how much fentanyl does it take to actually kill a person?
So if you looked at a penny, the size of Abraham Lincoln's head is a lethal dose of fentanyl that, if ingested, could kill a person. Carfentanyl's even less.
Wow.
So people may not even know they're taking it because it often gets mixed in with heroin, and I've heard cocaine now.
Yes.
And so just that little bit is lethal.
And the sheriff, when he's in with me the other day, said that they'd even seen traces of it now in marijuana at places. Where so now you think you're smoking pot, which is not that big of a deal, and you don't realize that it might have been dosed with fentanyl, and there you go. So a much more dangerous situation all the way around, and it's a scary situation, and it happens. It just way too many instances around here, and in fact nowadays it almost, when you take a look at the paper or you look at an obituary of a younger person, that's the first thing that goes through your mind. I think it used to be car accidents or something like that. Nowadays the first thing you think of is gosh, I wonder.
Very scary.
It is very scary. Tony, let's talk about 211.
Yeah.
Because that's another issue here
It is.
in Northwest Ohio.
Right. Well, when Family Service of Northwest Ohio announced that they would be closing, they were also the providers of 211. For the listeners, 211 is basically an information and referral service that we had locally. It's provided by United Way Worldwide and AIRS, which is the Alliance for Information and Referrals. Those are both national organizations. And they had contracted with Family Service to provide that information and referral through 211. It was really, really convenient. You could pick up the phone and dial 211, get your questions answered. When they closed, they also terminated their contract and made it nearly impossible for the board to come in, or United Way locally to come in and make any changes as far as bringing that back. It would be quite a process. What we have locally and what we'll continue to have always had, is our hotline. And that's the number of 1-800-468-4357 or 1-800-HOT-HELP. So that's kind of convenient. And so if someone locally has, maybe they need a local referral for treatment, or they have questions about any of the providers that we have in our 4-county community, they can still call that 800 hotline and get those questions answered. And that number will also continue to provide urgent care for psychiatric concerns. So, for example, we talked about somebody maybe needing to talk with somebody because they're going through, something in their life. They're feeling some depression and they just need some support, hotline support. Or maybe they need to access some emergency psychiatric care or mental health care. They can do that through the 800 number. So that's not going anywhere, but 211 in our area will end as of April 30th.
That's a shame. I don't know how many calls you took on that number in a monthly basis, but it was an easy number to remember.
It was an easy number, yeah.
And it's 800. What's our acronym again this time?
1-800-468-4357 or 1-800-HOT-HELP.
HOT-HELP. Okay.
HOT HELP.
1-800-HOT-HELP. Let's hope that will be a significant. That people will be able to get that in their mind as easy as 211, you
I
know,
th-
down there.
We're going to do a lot of advertising, education, and awareness on that. So
Good,
we'll
good.
continue to support that. And the other service that's going through some changes is the teen text chat line.
Okay.
There was a text chat service for teens. You know, they don't necessarily pick up the phone when they're going through something. A lot of the younger generation, they just feel more comfortable texting people about, you know, their issues. So we had a local product called Teen Text Chat, and that was also provided by Family Service. That will also be going away. The state has always had a text chat crisis line, but because we had a local product, that was something that we didn't advertise because it didn't make sense to compete against something we had locally. But effective April 30th, and actually this is available now, so your listeners could use it now. If somebody is going through something and they want to go ahead and text their issues and have that kind of support, they can text the number 4 HOPE. So it's 4 HOPE to 741-741.
Okay.
And
All
they'll
right.
get, just like they would if they called a crisis line, they'll get some guidance and support on what they're going through.
Well, that's good, and it's so important to have it right here, you
Mm-hmm.
know, in our backyard, because you know, it just, when you need it, you don't need to go to Columbus. You know, you need somebody right here that can help you.
Exactly. And the win for us, Jim, is that is now going to be available to both adults and youth. So you don't have to be a teen to access the crisis text chat line.
Well, that's good, because there's a lot of old farts like me that are starting to text. There's no doubt about that, and I might need to send you a text one of these days, rather than. Although I'm still more likely to just show up right there at your doorstep. You know, Matt, you had another comment we wanted to make there.
Well, just a couple of things. Again, just to reemphasize that the service location is the same.
Okay.
Many of the staff coming over are the same.
Sure.
And so again, there's no gap.
Yes.
It's just going to be seamless, if you will.
Yeah.
And then I don't know, Tony, if you want to talk
Yeah.
about the inpatient unit a little bit.
Definitely. One of the other services that was provided was a crisis stabilization unit for children and adults. This was 20 beds that was there at the 600 Freedom Drive location, 10
Okay.
youth, 10 adult beds. And they were used for individuals who didn't meet criteria, Jim, to be hospitalized,
Okay.
but maybe weren't exactly in shape to go home either. So they were sort of in that middle place. And what they were able to do was to go onto the unit, maybe correct some medications or correct a perception on a problem, and then they were in a much better place to be able to go home and rejoin the community. We looked at utilization of that service locally when we were going through the transition, and it was really low. In fact, out of that 20-bed facility, it wasn't unusual for there to be maybe 5 people on the unit, and you cannot maintain a 20-bed facility with 5 people on your unit. Now, we'll continue to monitor this, because I don't think that we're clear yet whether that underutilization was because of a lack of need in our community or it was because of some management obstacle that was going on with the delivery system. So when Matt moves into that, I know I'm going to steal a phrase that you used in a meeting. He's going to circle back around after we go through the initial transition. And again, with the board's partnership, we'll continue to monitor. If there is a need that's demonstrated in our community, we'll go ahead and take a look at providing that locally.
Yes.
However, the service is still available. Part of our contract expansion, Jim, is we went ahead and expanded our contract with UTMC Cobacker, which is a psychiatric hospital that serves children in Toledo.
Okay.
And then we also expanded our contracts with Arrowhead Behavioral Health, and they are located in Maumee. So if we have someone who needs crisis stabilization in our community, that is still available. We will put them in UTMC Cobacker if they're a youth, or Arrowhead for those adults. We've had a few folks that have already moved through the system, and it's worked very, very well.
Okay. Okay. Do you provide services like that, Matt, over in your existing business over in Toledo? Have you done that before as well?
We don't necessarily provide the inpatient psychiatric stabilization. We do more of that on an outpatient basis. However, Dr. Singh, who is employed by a Renewed Mind part-time,
Okay.
Who provides psychiatry, is the psychiatric medical director of Cobacker.
Okay.
And so we have a
Okay.
really neat relationship with UTMC. We've also, again, like Tony said, reached out to Arrowhead, and we've had a lot of success working with Arrowhead and getting people into inpatient care providing stabilization, and relinking them to outpatient services upon completing that level of care.
Well, good. That's good to know. Good to hear.
And we'll circle back too.
Attaboy.
Yeah.
We'll take a look at that. So this is stage one, stabilize.
That's right.
Make sure nobody falls through the cracks, and then we'll take a look at utilization and does that service need to reopen.
Yes.
So
Well, you're going to have to circle back with me too, because Tony's going to bring you back in here somewhere down the line, and I've made notes, okay, mentally.
Excellent.
That one brain cell's made notes. When he comes back in, we'll quiz him nastily right here
Okay.
on the radio. You know, yeah. Well, how about this? How about this, Matt? How about that? How about this? Have you fixed that yet, Matt? Did you circle back on that?
can I bring Les with me?
Bring Les along too, because
Okay.
he's signed up for another 35 years.
Yeah, definitely.
So he'll have plenty of time, and he's going to be looking for something to do now. Because he's kind of planned his retirement, and now that rug has been pulled out from underneath of him here at this point in time.
Yeah.
Hey, can I throw a curveball at you, because it seems like you two might be worthy of a curveball, and you can tell me it's around your pay grade or above your pay grade or whatever. There is a huge conversation going on about guns in schools and everything else going on right now. And in my mind, I understand. I still don't have an idea why somebody might need a gun that could, wipe out an army. All right, but they are legal in the United States right now, and I'll go along with that whole thing. But there is this question all the time of mental health checks, and it sure does look like there are some people that end up with weapons. Maybe they go get them out of their dad's closet, okay, which is a problem. But oftentimes they actually can go out and buy things. From a mental health perspective, okay, how do we approach something like that and keep those guns out of hands of folks who really shouldn't have them?
Yeah. I'm not really sure how to go about mitigating the means of access. I mean, that is a legal question.
Sure.
But I will tell you that sometimes when people are struggling with mental or emotional issues, they have times of crisis. That's just the nature of the beast.
Yes.
So in that time of crisis, is it a good idea for someone to be able to access a weapon? I don't know. My personal opinion is that it wouldn't be. We have to be able to keep not only the individual safe, but also the people that surround them. And
Yes.
I feel that if we can maybe limit that by some kind of a background check or something, to me that makes sense. I can't tell you that would be the official position of the 4-County Adams
sure,
Board, but definitely, I mean, I think we know that when people are struggling with mental health issues, there are going to be times of crisis, and so we would want to at least have a plan for putting some distance between them and that weapon, if not temporarily.
Sure. Yeah. Matt?
I don't know how you would identify somebody with a mental health issue for a number of reasons. Number one, many people don't seek treatment. Sure. Number two, 65% of our mood stabilizers, our medications, if you will, are prescribed by family doctors.
Sure.
And so really people aren't necessarily pursuing treatment. They're looking for a pill that will stabilize their mood. And then the smaller percentage of folks actually do come in for treatment. So I don't know how you would effectively identify somebody who has a mental health issue.
Sure.
So, I mean, is it a person who just had a cath or a heart surgery and now they have depression because they've had end-of-life issues? I mean,
sure,
it's really difficult. So
it is. It's not an easy question, and it's not as easy as just trying to find one thing that's going to fix the problem either. It's going to have to be a conversation at a whole different level, on all different levels.
And I think it's worth saying that if someone is experiencing a mental health crisis, the person who's most at risk is that individual.
Sure.
There is a greater chance that individual will harm themselves than harm someone else.
Right. Right. It's a difficult world. It's a difficult business. We really appreciate your guys' efforts, because there are people who need your help, and it's good to know that we're able to just bridge that gap immediately without any kind of interruption to service. So, Matt, it was wonderful to meet you.
Thanks for having me.
Good luck here on the western side of the state. How's that?
Appreciate it.
As you've moved your wagon and tent here a little farther towards that gold rush that happened a couple hundred years ago on the other side of the world.
I built a house. I didn't just move my wagon. I'm here to stay. So,
That's good news. That's great to hear. And Tony Long, always it's wonderful to have you. And again, please, anytime you guys have issues you want to talk about, do what you did, pick up the phone or reach out to me. And we do need to make sure Matt gets back in here a little later so we can kind of get an update down the road, maybe a year from now, once they really got their feet established and firm on the ground.
Excellent, excellent.
Okay. Very good. That's going to wrap up our program today. It's just before the 11 o'clock hour. As always, on Wednesdays, we talk medicine here on our medical hour, brought to you by the medical specialty clinics at the Bryan Hospital and the community health professionals. And that'll wrap up our show today. We'll get back into music right after the top of the hour. Cool.
The curveball.